Hello, this is Jonathan Kay from the University of Massachusetts Medical School reporting for Room Now at EULAR 2021. I wish that I was in Paris, but instead I'm watching EULAR 2021 virtually on my computer at home. I'm still a bit jet lagged because I had to get up at 4 o'clock in the morning to begin watching sessions today. However, I'll try to give this a go. Does treatment with antirheumatic drug therapy increase the risk of cancer among patients with rheumatoid arthritis? On the second day of EULAR 2021, a clinical science session was devoted to oncorheumatology. To introduce this session, Eva Sekenes, an oncologist from the University of Debrecen in Hungary, spoke about the intersections between rheumatology and oncology. Oncologic aspects of rheumatologic disease include secondary malignancies occurring in autoimmune inflammatory diseases, soluble tumor-associated antigens in rheumatologic diseases, and an increased risk of malignancies with some antirheumatic drugs. Rheumatologic aspects of cancer include rheumatologic paraneoplastic syndromes, autoimmune complications of checkpoint inhibitor therapy, osteoporosis occurring after hormone deprivation therapy for treatment of breast or prostate cancer, and malignancies of the musculoskeletal system. In abstract OP0187, Haragai et al. Assessed the incidence of malignancy in the IORA cohort of over 8,000 Japanese rheumatoid arthritis patients seen at Tokyo Women's Medical University between 2013 and 2019. They found the overall risk of malignancy to be similar to that in the general Japanese population, but the risk of lung cancer was significantly lower. However, as is known to occur in patients who have had active rheumatoid arthritis, there was a nearly fourfold increased risk of lymphoma. When compared to data obtained from the same cohort between 2001 and 2005, the lymphoma risk had decreased by 50%. They attributed this to better disease control achieved with the use of methotrexate doses higher than 6 milligrams per week, which is what used to have been the standard in Japan, and the availability of new biologic DMARDs and JAK inhibitors. Johan Askling of the Karolinska Institute reviewed the incidence of cancer among rheumatoid arthritis patients treated with biologic and targeted synthetic DMARDs. TNF inhibitors do not increase the risk of cancer over up to 10 years of follow-up and may offer some protection against the development of lymphoma. TNF inhibitors also do not increase the risk of cancer relapse. However, this may reflect a channeling effect of the reluctance of most rheumatologists to use TNF inhibitors in patients with a history of cancer. There is no signal of an increased cancer risk with either rituximab or tocilizumab. However, for abatacept, a meta-analysis identified a 20% increase in overall cancer risk that was largely driven by the development of non-melanoma skin cancers. Although it has generally been considered that there is no significantly increased risk of cancer with JAK inhibitors, a 50% increased risk of malignancy was observed in a study designed to assess the cardiovascular safety of tofacitinib. This signal should be investigated further in other studies of tofacitinib, especially in those of longer duration. If substantiated, the possibility of an increased risk of malignancy should be investigated for other JAK inhibitors. Askling hypothesized that the inflammation which drives the development of cardiovascular disease in rheumatoid arthritis may also drive cancer risk, not through a shared mechanism, but likely as a result of shared risk factors. Notably, channeling bias may account for the reduced occurrence of lymphoma and cardiovascular disease that has been observed with the use of TNF inhibitors. Although there is a theoretical risk that biologic or targeted synthetic DMARDs could affect cancer risk, in practice, they do not appear to be a major risk factor for the development of cancer. Most cancers occurring in patients with rheumatologic diseases have no relation to the underlying disease or to its treatment. However, follow-up in most safety studies looking at cancer risk has been relatively brief, up to 5 years in most. Thus, we do not know with certainty what is the risk for all cancers with all DMARDs. Much interesting information has been presented today. For more EULAR 2021 coverage, head to rheumnow.com. I'm Jonathan Kay.